Welcome to Travel Italia, the show about travel in Italy. Hi, friends. Welcome to the show. On today's show, we'll be talking about every traveler's worst fear, that is, getting sick. For those of you traveling to Italy, you've no doubt planned, thought about, and looked forward to your Italian vacation for many months. So if you get sick while on vacation, not only is it a huge disappointment and a wrench in your plans, but it can also be confusing and stressful getting medical care in a foreign country. What should you do if you get sick in Italy? Well, today's guest is the CEO of a company called Doctors in Italy that offers medical care to travelers in Italy, and she'll tell us about how to get care and will give us other important advice on how to stay healthy while traveling. So here's my conversation. Today on the show, we have a very special guest. We have today Nadia Necheva, who is the CEO of Doctors in Italy. Welcome to the show, Nadia.
Thank you for having me.
Oh, thank you for being here. I've been looking forward to this conversation for quite some time because it's a topic I think that's really important for people who are planning their trips to Italy. Of course, no one wants to think of getting sick while they're on vacation. That's not the ideal situation. But should it happen, I think Doctors in Italy is a great service. So why don't you start by telling us what is Doctors in Italy? What kind of services do you offer?
Well, thank you for the question. Well, Doctors in Italy answers the question to, well, will anyone ever want to plan being sick when traveling? The answer is, of course, no. No one plans to fall sick. No one plans to see a doctor while they are on holiday. But sadly, of course, it happens. Most of the times, gladly, it happens for minor issues. And consider that about 10% of travelers end up seeing a doctor while they're on their vacation. This doesn't mean that their vacation is definitely ruined, and that is the reason why we built this platform where they get to see a doctor who speaks their language, who is used to assisting patients coming from all over the world, who understands the peculiar needs of someone who is not from this country and may have even questions on how to buy a medication from the pharmacy or how does it work to manage a sickness in a foreign country. And we built this in a way that is as easy as possible so that it doesn't have to take time away from the main purpose of traveling, which is to have a good experience and see the place and do many other things different from staying home sick.
Right. Yeah, that is something no one wants. Okay, so let walk me through it. So let's say I'm in Verona on my honeymoon and I come down with the flu. So what is how does it work? Do I go to the website? What is the process?
So the first thing you would do is go to the website, and if you have it saved in your bookmarks, that will be easiest so that you can find it right away. Otherwise, look for doctorsinitaly.com, and you will find a big red button on the website that lets you request a doctor. And you will fill out a quick form. It takes about a minute to fill it out, in which you explain what your issue is. And I can say we get many questions, many requests, like I have a wedding tomorrow and I have a sty, or I am here on my honeymoon and I have a terrible bladder infection. This is a very typical situation in which the actual need of the requester is, I want to feel better right now, if possible.
Sure.
Once you send the request arrives directly to the doctors who are able to assist you, and they get back really within a couple of minutes. You will already have heard back from at least a few doctors who can see you, and you would know who is available, who can see you, what are their fees, and when they can see you. Typically, they can see you within the next 5-10 minutes, so it's a perfect option for people seeking for urgent care.
Okay. And so visits are either online or in person. What are the choices that?
Yes, that's correct. So that's something that you can select. So when you make a request, you can request an in-person visit, like at a medical office or as a home visit, or you can request a telehealth consultation. And telehealth consultations are recommended for common conditions that have an known diagnosis, easy to make, while in-person consultation may be necessary, for example, if you require an ultrasound scan or you need to physically be present in the doctor's office. I would say that most of our travelers actually need something that can be dealt with a video consultation. That said, we also have a clinic in the city center in Rome. We have another one in Milan, so we can assist also in person.
Great. Okay. So Rome and Milan are where your clinics are located. Okay, and so you said the doctors respond right away, and I can tell our listeners, and I don't have any agreement with doctors in Italy to say this, but I've used doctors in Italy, and I've been really impressed with how quick the response is and the level of service. It's a fantastic service, I have to say. Very useful for people who are traveling. But I wanted to ask you also, Nadia, is care available 24 hours?
Yes, it is. So requests arrive at all times of day and night, and there is always a doctor who's available at that time. Consider that many doctors do night shifts, they have different commitments, so their schedule is not the typical 9 to 5, and especially for primary care and urgent care. Of course, if you need to see a specialist and have an ultrasound scan, you may want to plan a couple of days in advance. And if you have, on the other hand, a major emergency, then yes, the hospital is probably the best way to head to.
Great. Okay, so you mentioned specialists. So what kind of specialists are available through doctors in Italy?
Gynecologists, obstetrics and gynecologists, following patients either for regular checks, but also for acute conditions or pregnancies. We have dermatologists on the platform, both for in person and telehealth consultations. They can happen to be very handy over the summer when we start having bumps and red spots and we don't know what it is. And we really need someone to help us get better. We have orthopedic specialists, we have internal medicine specialists, and other different types of specialists depending on the condition. Our advice is to start by seeing a general practitioner if you haven't seen already a doctor who has already told you to see a specific specialist, and then go from there. That's usually the best choice. And I know this is sometimes confusing because depending on the country from where you're coming from, you can be used to something different. For example, in some countries, general practitioners do pretty much everything, including pregnancy checks and gynecology appointments. In other countries, on the other hand, you would go see a specialist even for an earache or for throat pain or for sore stomach or anything else. So in Italy, I would suggest to start with a primary care physician, which we call urgent care on our platform.
Okay, that's a great point to make. Great piece of advice because you're right. Things work differently all over the world, right? Okay. I wanted to ask you also, how are the doctors vetted?
That's a very good question. So we interview every single doctor who comes on our platform. We verify their credentials so that we are absolutely certain that they are physicians and they're registered and authorized to practice. We verify their English level, and we have a way to test both their technical skills in terms of ability to diagnose a condition even through telehealth, and something that is less obvious, their so-called website manners or bedside manners. So their ability to interact with the patient from different culture and to create a pleasant environment, which we have seen is very important for good health outcomes. So we want patients to feel heard and to be able to ask questions so that they they will be confident that they're getting the best care,
Right. Good point.
as their biography and description of their previous past experiences and work experiences. So you get to choose the doctor that you see.
Great. That's good to know. Okay, Nadia, what advice would you have for tourists visiting Italy with regard to staying healthy while they're in Italy? Do you have any general advice for tourists?
Well, a good general advice is to pack enough of your regular medications, the ones that you take every day and that you cannot stay without. Consider taking a few more in case you spill some, you lose a bag or something, and to split them into different bags into your luggage. This helps save you in situations in which the medication that you regularly take is not available in that country. Another tip is to drink a lot. This is something that you tend to forget because you're walking around, you don't want to be looking for restrooms, so you forego the importance of hydration, which can lead to issues when traveling and can be one of the reasons why you feel sick or you have a headache or you don't feel at your best. So, this is a practical tip. And well, don't overdo. Consider also some sleep. You may want to skip that one tour that you plan to do at 6 a.m. in the morning if you're feeling tired. Don't worry, you will sleep plenty. So don't overexert yourself.
Yeah.
It's fun and it's nice, but it's still tiring. So consider getting some rest.
Yeah, excellent advice, especially hydration, right? Because on a long flight, we are it's dehydrating to travel on a flight to begin with. And yes, I totally agree with all your recommendations. Okay, so in my last question for you is, what should a tourist do in case of an emergency, a real medical emergency?
So, my advice if you're experiencing a medical emergency or something that you believe could be an emergency, and you have symptoms that may seem something scary, and you need immediate medical attention, don't worry, get to the first taxi you find and go to the closest emergency room. Don't worry about the cost. Consider that emergency rooms for actual emergencies tend to be very affordable in Italy. In some cases, you may have to pay a very little fee or even no fee at all, depending on where you come from. So don't worry about breaking the bank if you're having an emergency. So just head to the closest hospital, look for one that has an actual emergency room, which is called pronto soccorso in Italian, and then they will take care of you.
Mm.
And if, on the other hand, your case is not a medical emergency, but it's something that is urgent to you because you want to get rid of it quickly, like a painful UTI or sinus infection or a terrible sore throat, something that is making you miserable and you want to get rid of it pronto, but you don't really risk your life, you're not in a life threatening situation, going there would burden the staff of the hospital with something that is not an actual emergency and take attention from someone who actually needs it. And it may lead you in waiting many, many, many hours for just getting 5 minutes of time with a doctor who will prescribe you the medication. In that case, I would consider looking for doctors in Italy where you can get a telehealth consultation and prescription in minutes.
Great. Yes, exactly. And maybe something I should mention also is that right, you don't, like you said, you don't want to wait for hours and hours in an emergency room to get something treated that is minor, because the way the Italian hospitals work is you enter the hospital and they will give you um, a color code depending on the urgency of your medical condition. And if you get, say, a green code, it means that you can wait, and so you may be waiting a very long time for something minor. So that's a good point to make. Thank you, Nadia. Well, Nadia, one other question that just came to mind for the telehealth visits offered by doctors in Italy. Can you give us an idea of the average cost for a telehealth visit?
Sure. Well, on average, telehealth consultations go between 20 euros and 35, 40 euros sometimes. It depends on the doctor. So each doctor can set their own fee. We just want to make sure that the fees they set are the same they would do for Italian local patients, so that we check that they don't price gouge and they don't overcharge travelers, which this is something that is very close to our mission. And we don't apply any extra charges and overcharges. Sometimes for very easy conditions and quick questions, you may pay even less. So sometimes I've seen consultations at 15 euros for minor conditions. While if you want to see, for example, a specialist or have a complex case to discuss, it may go up to 50, 60, 70 euros. But
Mhm.
in that price range, typically. And we do accept also insurance. So at the checkout phase, you can add your insurance details, and if possible, we will bill your insurance directly. If not, your credit card will be charged in a few days.
Great. Thank you so much. I think that's super affordable. And it really, I think, puts travelers at ease that, getting sick while you're traveling doesn't have to be this big stressful event. If you know what to do and that it doesn't cost an arm and a leg. So thank you very much. Nadia, thank you so much for your time. It's been a great pleasure. Thank you for all this really useful information for our travelers. And it's been great talking to you. Thank you.
Thank you so much, and thank you for hosting this podcast. I think it's very helpful to have local information for people coming from all over the world to reduce the stress and increase the enjoyment.
Exactly, exactly. Thanks.
Thank you.
Well, folks, that was my conversation with the CEO of Doctors in Italy. You'll find a link to their website in the show notes. I hope this episode has been helpful to you and maybe eased some of your fears about traveling. I highly recommend that you bookmark the Doctors in Italy website before your next trip. I wish you a buon viaggio. Ciao.